Hello and welcome to Miracles from Mott, Michigan Answers for Kids. I'm Tati Amara. Today is certainly a day to be thankful for many things, especially the University of Michigan Health CS Mott Children's Hospital. Every day, teams of dedicated people are changing children's lives in extraordinary ways, from advanced technologies and breakthrough treatments to leading-edge surgeries. In the next half hour, we are going to introduce you to some special families who directly benefit from this pediatric expertise. We'll also talk to some of those specialists who are truly making a difference. Of course, none of the extraordinary work done at CS Mott Children's Hospital can be made possible without help from donors like you. As a not-for-profit organization, they depend on generous gifts from their supporters. So today, we are asking you for your donation by simply scanning the QR code on your screen. We hope these stories we share with you today inspire you as much as they have inspired us.
I was doing 500 push-ups a day to try to get stronger and just see how far I can push myself, how good I can get. And my left arm started to hurt a lot, the muscle. And I thought I was just overworking it. And my mom and dad thought that too. So I took it down to 100 push-ups and doing what I used to normally do. But that was still hurting.
One time he was in a crazy amount of pain that we went to the ER, and I told this doctor, I said, look, his 2 is my 10. He's not a kid that's gonna be complaining about stuff unless it's really, really hurting. And they ended up sending us home. We followed up with a recommendation that I got from my sister. She said, go see this orthopedic doctor at U of M in Brighton. So we went to that appointment, and they x-rayed him, and when the doctor that we had just met came back in, you could tell by his face that he didn't want to have to tell us what he was about to tell us. And he said, there's something really concerning here in the imaging, and it's either bone infection or possibly cancer.
He was diagnosed with the most common bone tumor called osteosarcoma. And osteosarcoma can be anywhere in the body, it's typically common in the long bones, but he had it in his humerus. So obviously it was his upper extremity that was affected. You know, this is a kid that likes to play every sport, loves basketball. I think he lives on the basketball court, and he plays every other sport that I know of. And so that was the most devastating thing for him, is to, learn what he can or what he can't do.
One really hard time was James facing this idea of being forever restricted in doing the things that he really loves to do, like football, basketball, wrestling, track. So James had a really tough decision to make about amputation, or Dr. Siegel said, I think we can save it. He said, now the nerves can't take a joke. You might lose hand function. You might not be able to use your wrist, but I think I can save it. I know I can build you a new shoulder, a new humerus, and a new elbow. We're gonna drill into that ulna. So James decided to trust Dr. Siegel to rebuild his arm. So he's got an endoprosthetic, the prosthetic's in his arm.
I remember they said they went really well. Everything went well, it's okay. And that it'll probably be a couple days before I get movement, even in my hand, back. And I remember the next day, I was already moving my fingers, which was a really good sign. So I managed to get mobility back in my arm for the most part.
With osteosarcoma, the good news is there's a protocol that is the same around the world. The bad news is it is grueling, it is intense, and it's long. And it involves surgery and a lot of chemo and what turned out to be 80% of a year in the hospital, which changes your life.
The difficulty these children go through is the disruption in their life. We can provide medications to help with the pain. We can have a psychologist come and see them and try to talk them through, the difficulty they're going through. But nothing changes the child's mood more than seeing an athlete or somebody that they look up to come and visit them and then give them the hope. So this happens a lot at Mott Children's Hospital in the inpatient unit.
I got to meet some really cool people that I probably wouldn't have been able to meet if I hadn't gotten admitted with the cancer. I think he's the starter right now, Davis Warren from Michigan. He went through cancer in high school. And he's just someone I could really relate to because he's a football player who's gone through it. He's doing it now. He's doing it at a high level. First time I met him, he played catch with me for a half an hour, which was just really nice. And I just felt really grateful for that. And then I know I've gotten to go to a couple nice big games. I went to a Lions playoff game because of one of the players who I met, Aiden Hutchinson. He had maybe one of his heroes of the week. And that was the biggest, best game I've ever been to.
It's hard to talk about this hospital without just naming people.
That would take 30 minutes.
I know, just naming people that have just been there for you and taken care of your most precious.
When my mom was pregnant with me, around 20 weeks, they found out that my coarc was completely closed off, and I had a hole so large that it wouldn't have closed on its own in the lower part, and then I also had a non-functioning aortic valve. So they came over to Mott immediately. They knew that Dr. Bove and Dr. Oye were over here and that they were probably the best surgeons for that defect at the time. So at 8 days old, I had what was called a Ross procedure done by Dr. Bove, and Oye was a resident at the time on my case.
The Ross procedure, which is a way to replace the aortic valve, and it's particularly applicable for younger kids where we don't have other options. We don't have something made by a factory. So the Ross procedure is a way to use one of their own existing valves and put it in the aortic position. The idea of using them in newborns was pretty foreign back then.
So then around 20 weeks when we found out we were pregnant with Jeremiah, we were told that he had coarctation of the aorta. So the same defect that I was born with, a smaller left side, but functioning, and then a hole. So we immediately reached out to Dr. Oye, who was a fellow on my surgeon, and kind of were like, hey, this is what's happening. You made such a big life impact on me. Could you help us with our kid and help us save his life?
Here's a mom that I had the privilege of taking care of as a fellow, and now she's coming back asking me to take care of her son, who has a very similar issue, and it just felt like it was meant to be. You kind of get that full circle feeling, because he had a very similar problem as his mom did, and with the exception, his aortic valve was okay, but he needed his aortic arch reconstructed.
So at 7 days old, Jeremiah had what's called the hybrid procedure done. So they took and put PA bands on the two arteries that take blood out into the lungs to kind of restrict that, and then put a stent in his coarc to kind of open it up. So restrict blood flow and kind of push it into his coarc to help move it so that he was getting blood to his lungs. And then in November of 2023, we spent our first Thanksgiving here. They did his coarctation repair. So they took that stent out, took the PA bands off, and then reconstructed his arch to open it up so that blood could flow without assistance.
And it's called a hybrid because it takes part of surgery and part of cath labs, so tries to minimize invasiveness early in life. Outlook is really good for him, and we just want him to be a kid. I mean, that's really the goal of what we do. We want the patients just to be able to be like normal kids and do all the normal kid stuff, and he should be able to do all that stuff. Jeremiah's journey it's been rough, but it's been a journey of empowerment and motivation and courage.
Now we're past the surgeries and we're fully recovered, and we're just hoping that he can live as close to a normal life as possible.
I'm Luann Thomas Ewald, the Chief Operating Officer at C.S. Mott Children's Hospital at University of Michigan Health. We are so excited about our new joint venture with Trinity Health Oakland in Pontiac. We are bringing the pediatric subspecialists from C.S. Mott Children's Hospital right into Trinity Health Oakland. We have pediatric cardiology, pediatric gastroenterology, pediatric hematology and a new infusion center, pediatric orthopedics and sports medicine, pediatric ophthalmology, pediatric surgery, pediatric urology. We have an amazing pediatric inpatient unit and a neonatal intensive care unit right at Trinity Health Oakland. We also bring the service from Ann Arbor, which is our amazing child and family life specialty. Our child life specialists really work with the children during their clinic appointments, during inpatient stays, and in the neonatal intensive care unit. They provide play, distraction, and anything to really help get the child through their treatment or their procedure. To learn more about this amazing partnership at Mott Children's Hospital and Trinity Health Oakland, please visit mottchildren.org/Trinity Health Oakland.
The Paws for Patients program is a facility dog program here at Michigan Medicine. We have 7 full-time facility dogs that work throughout our health system. 3 are dedicated to C.S. Mott Children's Hospital and are assigned to specific units here within the Children's Hospital. And then we have 4 other dogs that work within our adult hospital across different units there. Our facility dogs are trained to kind of check in and assess the people that they're caring for. So often when they enter a room, they're going to go to the person that might need the most support. That may be a patient, that may be a parent or a grandparent or a caregiver, and they're really going to kind of lean into that person and offer that support for them.
Evan was in a dirt bike accident. He had broken almost every bone from his eye down to his toes. He stayed for 2 months. During that time, he underwent 13 surgeries, 7 blood transfusions, and was discharged in a wheelchair with a feeding tube.
There's like a dog at this hospital that helps me with appointments and stuff. His name's Barney. He sometimes goes to surgeries with me. He
laid in your bed?
Laid in my bed.
Evan had a pretty traumatic experience, and coming here for his care, he was able to obviously get the medical support and help that he needed, but that didn't necessarily solve some of the traumas that he had experienced. So Barney played an integral role in helping to kind of support him through facing some of those fears.
The stress of having to get in a wheelchair after being in bed, for a month at that time. One of our goals was to be able to see the helicopter, because the Life Flight team came in to the intensive care unit and introduced themselves and said, well, when you're feeling up to it and you can get in a wheelchair, we can take you to see that helicopter that essentially saved your life. And he was scared to go into, an elevator. You think, oh, you've been through all of this stuff, it should be easy. Not necessarily. It's still something you haven't done before, So Heather from the Child Life team brought Barney, the dog, in and said, well, we'll take him there. And that's what they did. They came and met us in the room and took us the entire tour over to the Life Flight pad, and the staff met him there and took us right out to the helipad where he was able to take pictures.
We get wonderful feedback from the parents, caregivers, staff as well. It's an additional support service that we're able to offer here that brings that comfort from home. It just adds another layer of care and service here. So it's incredibly important, especially when we're caring for other people's children and other people's family members, to be able to offer that support and that care here.
There's other dogs here that visit. We are an animal family, so that was huge for us, just to have some sort of normalcy when you're up here in a hospital setting. And for those of us parents that, never leave and stay with their children the whole time, of course, I mean, I would never do it any other way, but it makes you feel a little human to have some of those things that provide comfort when you're not at home.
I originally took her downtown Detroit where she was having seizures. I didn't get the answers that I thought that, I could get from there. So I told my mom I'm going to take her to Mott Hospital, which I've always heard was a great hospital. And on my way here, Madison had a grandma seizure in the car. It was like 11:30 at night. I called 911. They met me on the side of the road, came and got her and drove her here. And the way they cared for Madison, at that point, I knew I chose the right hospital.
We have a very extensive epilepsy surgery and epilepsy program here at the University of Michigan, where we try to individualize treatment for people with epilepsy, specifically kids with intractable epilepsy, meaning that they've tried 2 medicines and are continuing to have seizures. And so from the moment we bring them in the door, we figure out what's the right treatment. Is it medication? Is it dietary treatment? Or sometimes the answer is epilepsy surgery.
It was a hard time to see my child go through that. She went from 10 seizures up to 20 seizures. I had no idea what was going on. I'm thinking, was it something I fed her? Was it something I did wrong? But it was a hard time to see her go through that.
It was just really scary because I remember the seizures vividly now, and just experiencing them then was just really intense and scary for me.
And within that year, I noticed a twitch of her left side, her left arm, as if someone with Parkinson's. And I called her neurologist, Dr. McNamara. I said, hey, something is going on, with Madison, along with her having the seizures. They said, well, she's probably going to need a brain biopsy to see if she's having the rare form of Rasmussen's. So I said, okay, let's do whatever I can do to save my child.
Madison has a unique kind of epilepsy called Rasmussen's encephalitis, and it really, as typical, it's not very clear at the beginning when somebody starts to have seizures that that's the cause. It's something that kind of shows up over time, and sometimes seizures can be brief and even for a short period of time be controlled, but then over time the seizures worsen and it actually starts to cause atrophy of the brain on one side, and then unfortunately it can also cause weakness on the opposite side of the body. And the treatment for it is actually a hemispherotomy or a hemispherectomy, where one part of the brain is either disconnected or removed completely.
I had to relearn everything. Like sometimes it'll feel like, oh, I can get up and walk, but then every time I try, I can't really do anything about it. But yeah, I had to basically relearn everything as if I was a newborn.
I'm big on working out, so I said, okay, before you get to surgery, we gotta work out. After her surgery, we still worked out. Gotta make sure she get her exercises, her stretches in with her left arm, her left hand. And I still keep her working out with her left leg, because I still have faith knowing that someday her left arm, she's gonna get abilities in her left arm and left hand someday, so.
She's done great over the course of the 6 years. Seeing her go through that, it was hard in the beginning. She had to learn how to walk, talk, eat, swallow, everything all over again. But she's just conquered everything. They told her, Madison, you might not be able to do, I go to general ed classes, for instance. And she's proving everyone wrong. Madison, you may not be able to swim. She's proving everyone wrong. She's just a remarkable young lady, and I love her.
I just wanted to be that light and that hope for people that feel as if they can't get out of any situation that they're dealing with. And I just wanted them to know that there's light at the end of the tunnel, and every down has an up. And just because you're mentally disabled or physically disabled doesn't mean it's the end of the world. You still have life to live.
Roman, he's super playful and curious and definitely determined. He's only 6 months old and he's been through more than adults have been through into their entire life, and he's the happiest little kid you'll ever meet. At my 24-week appointment, they had to do another ultrasound, and they saw something different. That's when doing more echoes, they discovered it was dilated cardiomyopathy.
I first met Roman when he was just hours old. He was found to have one of the most extreme and severe cases of dilated cardiomyopathy that I have ever seen. So the heart's supposed to be a pump, a strong muscle to circulate red blood cells and oxygen throughout the body, but his heart was literally just a big, boggy bag or a balloon, and it wasn't doing anything that a heart needed to do. We all decided that he needed more circulatory support in the form of the Berlin Heart pump. We use the heart pump to not only circulate the blood better, but also to keep patients alive and to bridge them to potentially getting a heart transplant.
Today is transplant day, and now we're waiting until tonight when he goes down. When Roman went down for surgery for his transplant, they clapped him out to the elevator to go to surgery, and so everybody came out with bells on to send Roman off because he made it to his goal. We are 1 day shy of 2 weeks out, so 13 days post-transplant. He is doing phenomenal. He is almost back to himself.
Our heart transplant patients need to take anti-rejection medication or immune suppression. So unfortunately, when you take immunosuppression to prevent rejection, you're also at higher risk of developing infections and some forms of cancer. We found that Roman had developed a form of gut cancer about 9 months after his heart transplant.
Like a numb state almost, where just you're trying to wrap your head around it. Like, he just went through a heart transplant, and now this kid's going through another thing that, like...
Give this kid a break.
Yeah, just give him a break.
He must have been not feeling good for a very long time, because once he started chemo, holy cow, he started running. That's when he started walking, and that's when he started eating, and he was just so happy. And a little over a month, I think it was 5 weeks between his first round of chemo and his first set of scans during chemo, and he was, it was gone. There was no signs of it in the CT or PET scan. The name Roman came from the WWE wrestler Roman Reigns. Roman Reigns himself is very strong and stoic. He had cancer at one point in time, fought and beat cancer.
Roman has absolutely lived up to his namesake. I can't think of a tougher dude and fighter. And I think even more, every opponent, every battle that he has faced has been real, truly life and death, and he's absolutely crushed all of them.
Zach was born in California. He was born early, 28 weeks, and around day 14, unfortunately, Zach suffered a gut infection. He went septic, and during his resuscitation, he suffered a pretty severe brain bleed, leading to brain damage.
The neurologist at that hospital told us that basically we had a 50-50 shot to live year one. And so, you know, he basically just prepared us for the worst news possible. And so looking at Zach, we were in a room with Zach, and he was kicking and laughing, and he had just been through this extraordinary experience medically that we didn't think he was going to survive through. So we kind of knew like he had a fighting spirit and a good attitude, and that kind of drove a lot of our effort and our advocacy.
Brendan and I are local to, you know, the Metro Detroit area, and so we had always known about MOP, but we'd never experienced MOP or had been here. And we kind of looked at each other and just felt that that's where we needed to go. Zach was born in October, so he was only a couple months old. And you walk in the door and we just felt the difference compared to where we were. The life and the atmosphere when you walk in this place, and the embrace and the comfort that you feel. And so like, I knew we made the right choice.
The very first hour that we met, we had a couple pediatric surgeons in the room, and we went from surviving to hope. And that was a dynamic that I don't think we were expecting. Mott was able to give us not just year one, but here we are, and Zach is 9.
When you hear such devastating news, and then you come to a place where it is a completely different mindset. They are making all these new plans, all of these things that they can now do that we didn't even know were options. You know, Zach growing more intestine, because unfortunately during the initial infection and stuff, Zach lost most of his small intestine. And they were like, oh no, he's still, 2 months old, he's gonna grow, and he's gonna grow more. And so he's had endless surgeries now, and he grew like, 22 more centimeters of small intestine, some crazy number. And so it was pretty amazing to see the team come together and start a true life plan for Zach and where we were gonna direct his care.
The Partners for Children program is a program through Mott that helps children with complex chronic illnesses. So we were started in 2018 for kids that have 3 or more specialists, 3 or more organs affected. We're very big advocates for our family. That's one of the things that we are able to do. We have nurse practitioners, social workers, nurses, admin staff that all work together as a group that is there for the family, and then that can talk to the physicians and see what we can do to help those families in the long run.
The beautiful thing about Partners is it's a direct line of communication, but they'll also come to our home and then evaluate Zach's needs, have an open discussion that's global. So we talk about all of those specialties that are following Zach and making sure that all of our concerns and hopes and anything that's outstanding is really addressed, but they also facilitate all that communication with our specialists. So the ability for us to enjoy the time we've had with Zach has been the blessing that we didn't expect. I think had we not come to Mott, I think our story may have been much different. Thank you,
For saying yes, thank you for saying yes.
Adopting our family.
That first day that we called from California, when they said, yes, we will hold a bed for Zach, that is the moment our lives changed for the better.
Thank you so much for joining us today. We want to extend a big hail to all the little victors and their families who graciously shared their stories with us, and to our community for your generous support of the life-changing work the teams at Mott are doing every day. Thank you. Happy Thanksgiving.